So what's the difference between botched and beautiful? No. Botched and the results that you actually love, it all starts with one thing. It's the consult, and most people don't even realize it. Hi, my name is Brooke Carrero. I'm a aesthetic nurse injector in the Philadelphia area. Today I'm gonna actually demo consults, and I'm gonna show you the importance of a consult. Sometimes you call in, you want lip filler, but you get into the provider's chair, and the provider has a whole other plan, but there's not enough time allotted for what you need to do. So we're gonna take a deep dive into what the patient thinks they need, and how I would assess the patient, and why I always now encourage pre-assessments when 1, you don't know what you want, or 2, you're just not sure, but you want to maintain this natural kind of outlook. So my suggestion is always, always, always call first. Set up the consultation before injections. Consultations, pre-assessments are so important. You can't do these all in one day. It's just too hard. And I'm going to show you why. We're going to do examples of if this patient comes in for one treatment, but she needs another, and we don't have enough time, and she traveled all this way to come see me, how we kind of handle that. All right, first thing I do when I start my consults is give the patient the mirror, and I'm always asking them what they're drawn to. If there's one thing that they could enhance about themselves, what would it be? So let's go, Brett.
So I feel like my lips could be bigger. So that's what I'm drawn to.
Okay.
I also feel like I need a chin as well. So that's another thing.
All right, so this is why the power of a consult is so important, because let's just say Brittany came in without having this consult and she made an appointment for lip filler, right? That's all I had time for. Now looking at her, she doesn't need lip filler. She mentioned chin, and that's exactly what we need to do. When I'm looking at her, turn to the side, if we add more volume to her lip, it's actually going to make her chin more recessed, again, giving her that Marge Simpson look, and that's not something that we would do. So Brittany just came in here for lip filler. It's going to throw her whole face off balance. But if we take the time, we have a consult, we're able to approach the face and look at it in a whole. We're able to say, no, you don't need the lips. This is why. It's not me upselling, it's me educating the patient on if we do this, it's going to throw that out of balance. So this is where we get some of my little rulers coming in, right? And I tell her I want the lower lip to line up with the chin. So again, if we turn all the way to the side, we want that lower lip to line up with the chin. She's got about a 1/2 inch deficit. So for her, my goal would be, and you can come back this way, my goal would be lower lip in line with the chin. We want that lower lip in line with the chin to be the length and project out till it matches that. Okay, so that's our end point there. Then we also want to look at, is it masculine or feminine here? So masculine or feminine, corner of the nose straight down is where the width of a female chin should be. Male, corner of the mouth straight down is where the masculine chin should be. So she's a little bit masculine here. We want to feminize her. But again, these are things during a consult that you're able to talk about. Why we're doing things, what ratios matter, and now Britt can sit here and ask all her questions instead of her just scheduling for lip filler. Then I'm trying to be like, no, we need to do this. So consultations are important because patient can ask the questions. I'm able to explain why we're able to do things, and then we're able to come up with a treatment plan. So how does that sound, Britt?
That sounds good to me. I didn't know that. I had no idea like what was masculine or feminine looking. So yeah, and I don't think most people do. So it is good to come in, talk to you first, and then
ask
go
questions.
From there. Absolutely.
Yeah. So this is round 2 consult. Someone that has never had anything done. So these are my ideal patients because they have really no idea about anything, and you're able to come in for a consult and we're able to talk through it all. You've never had anything done. Like, what questions do you have about this?
I'm scared about filler.
Okay. Why are we scared about filler?
I'm scared of what it'll look like in like 5 years.
Yeah.
Or if I'll look weird as I start aging.
Yep.
And then like when and if I need Botox.
It's a really good question because I feel like so many people are scared of filler. They think filler is going to make them look fake. Now, how I do this is we're aging, right? You don't look like you look like 5 years ago. Your face is changing, okay?
Yeah.
So filler isn't meant to change your face. It's meant to restore the volume that you lost. So when we're thinking about the future, our face is constantly shifting and changing, but we're not thinking about future, we're thinking about what you looked like previously. So think restoring volume that was there 5 years ago. It goes back to balancing versus augmenting. We're not trying to augment anything. We're trying to restore. I've had filler in my face for well over 5 years, and it has not made my face look different at all. The only thing that's making my face look different is how I'm aging. How I approach this, if someone that's never had anything done, honestly, I'm starting them off with tox, and you've never had it, right? Tox is preventative, prevents lines from getting worse. Once you start seeing that crinkling at rest, which Lindsay doesn't really have any. She's got the tiniest bit of faint line in her forehead. That's when you want to start getting neurotoxin. So if we see these faint lines at rest, that's when we want to get it preventatively, but there's certain things that we have to look at as well. Lindsay naturally has a lower set brow. Any paralyzation to this forehead is going to make her feel heavy. So personally, I actually wouldn't inject your forehead. I would inject the middle and around her brow. They're the depressors of the face. I always call that like the mask. Treating the middle and around the brow, that's actually going to open her up. So that's going to give her a lot of lift, which I think would be nice for you. Again, you really don't have resting lines up here. I mean, she's someone that I would talk about baby tox for, which honestly, I don't love the term baby tox, but it's really just a light amount of neurotoxin to kind of help soften, but not completely knock out. But for you, I would say no to the forehead. We would do the middle and the brow. So that's where I would start. Dip her toe in the water before we got into filler and facial balancing. So once you got a little bit of comfortable with needles in your face and comfortable with me and we're building this relationship, then I would move forward with assessing you for filler and what you need. So let's just say we did your first tox treatment. You were happy, you're like, I'm ready to jump in. This is great, I feel good. Then we would move into balancing. Things that I would be looking at. Temple's one thing that I would start from. So you can see the bony prominence of the tail of her brow. You can start to see she's got a little bit of step off in her cheek right here. And then her temporal fusion line is present. So these are some things that I would look at when I'm diagnosing a temple. So for her, I'd say her temple is pretty mild for the most part. So it's something that we could wait or treat now. If we were to treat this, we could either go the route of Sculptra or filler, but it would be very small amounts just to give a little bit of volume. It would help with the tail of the brow. So that's one thing that I would do for her. Would you agree?
My main thing is like just like volume loss.
Volume loss.
Like I feel like my cheeks aren't as chubby, and then same with like they're just more hollowy.
Yeah.
Like I feel like my face looks like longer.
Yeah. So going back to that comment that you said where you were scared to get filler because it was going to change your face is changing. You just said your face isn't as full and it's not as chubby and it's like getting like longer because you're losing volume. So that's all I'm trying to do. I'm not trying to change. I'm trying to give you that volume back. Does that make sense? So a little bit of temper filler I think would be awesome. And again, Sculptra versus filler, we could always talk about that at a later point. All right, so when we're talking about the cheek and those fat pads, again, some of the fat pads lose volume. Then you have ligaments that get weak and everything kind of comes in and down, right? Which we all age centrally. So when we're looking at Lindsay, she's got this high point up here where the light reflection is, okay? When we're coming to the side, she's got a little bit of break in this fat pad here. So that is giving that illusion of there's that hollowness in the middle, right? So really what we want to do is think about like reconnecting the fat pads, bringing more volume back into here, and it's going to give just a little bit more life back. And it actually helps us support the under eye as well. Do you see the difference of that there? Like just the littlest bit of volume there. So no lateral cheek, just a little bit of volume. And you said you had chubbier cheeks when you were younger. Like that's what I'm trying to give you back. That's it.
I like my chin, but then sometimes it can seem like not as nice.
So it's all about, again, you have, when you're looking at you from the side, you have the length, right? The length, the lower lip and the chin are supposed to be in line. You got that. Some people are recessed. It's like that Marge Simpson look that I told you that people are getting. You don't have that. It's all about light reflection. Where is the apex of your chin? So when I'm looking at you from the side, if you look forward like this, so how you find apex is you take the lower lip and you tap the chin. And if you saw her apex tapped high here, so come back to me. Yeah, her apex is all the way up here, okay? You want ideal apex to be about 1 centimeter above the jawline. So if this is the jawline, about 1 centimeter above. So really all we're trying to do for her is just drop that light reflection down a little bit. So dropping the light reflection to here, it will draw the light down a little bit more. It will actually give her a little bit more definition too.
So it'll kind of make my jawline appear?
Yes, because right now you're higher. It's higher. We want to lower it down here. It's actually going to elongate it a little bit more. And then from there, we want to talk about this pre-jowl area here too, because if we change this light reflection, we have to look at the fat pads that surround it. So this pre-jowl isn't an area that someone's going to come in and say, oh, this is what I need, but this almost gives you that lip framing, right? Now we want to look at the surrounding areas. And again, this area, this kind of helps to support the marionette. It helps the transition between the chin and this marionette that comes down here, and it supports the lip. So just a little bit of filler here, but if you notice, these are like little tweaks. Like there's not really much that I'm doing. I think people think facial balancing has to be dramatic, but Lindsay's somebody that takes care of her skin, that like drinks water, that is healthy overall. So this is why her skin looks the way that it looks. I tell people you can do all the Botox and filler in the world, but if you're not taking care of your skin, it doesn't matter. So for her, because her skin is healthy, it's little tweaks and adjustment for volume loss to maximize the benefit of balancing.
With the jowl thing, does that help prevent like the pre-jowl to start appearing as I get into my late 30s?
Yes, so that's the thing though. So this pre-jowl area that Lindsay's talking about, this is a fat pad that unfortunately gets bigger as we age, okay? So it's this area all right here. Now what's happening, it's the nasolabial fold fat pad, it's getting weak and it comes down and it gets bigger. So you get this like ball sack on the side of your face, honestly. So really the only thing to do with that is when we get older, facelift to pull the skin back, but she's not there yet. You have volume loss in front of it. This gets bigger, so what can you do to kind of hide the jowl, really? We can do a little bit of neurotoxin in the platysma band, releasing this jowl right here, okay? Then we also can put filler in the front of it. Again, think makeup, like you're blending makeup on your face. So you fill in front of that just to hide that transition where that heaviness is coming from. You think, oh my God, this is so much, but those little minimal tweaks make the world of a difference.
Would you do any Sculptra within this consult, or would that be sort of something that we talk about, whether it's filler or Sculptra?
So honestly, remember we talked about Sculptra being mild to moderate, not severe patients. If you're someone that's like, yo, I'm scared of filler, this is something what I do, you're a mild volume loss, you could absolutely do Sculptra to start.
Okay.
Yeah, no, in all of these areas.
Interesting.
Yeah, so power of a consult is if Lindsay came in and just made appointments for lips, but she gets in my chair, she's like, I really want to make sure my face is balanced overall. I don't have time in a 30-minute appointment to be able to go through this full consultation. And even doing this the same day, like if somebody wants consults and injections, I don't know what she needs. And for me to be able to go through this whole consult, and again, this is just a snidbit of what I do. When I do a full consult, like you are sitting here and I'm explaining everything, to be honest, it takes 30 to 45 minutes for me to get through the consult. And then you want me to inject, it's just long. So what we've been trying to do is I do these pre-assessments over the phone that are like 15 minutes where you're sending me photos, telling me your concerns, and I'm able to give you roundabout pricing for what we're doing, so there's no surprises in the chair, because that's always an uncomfortable topic too, like what you're spending, what's your budget. You're able to see everything right there. That way we know the allotted time for what we're treating you with. And once you're in my chair, we're able to go through consult and injection same day. But we kind of have already a plan, instead of just, oh, I come in for lip filler, but I have questions about all these other things. If you're a patient that has questions about things, always ask for the consult first. If you're someone that comes in for a treatment, but I'm kind of pivoting you in another direction, and that's not your priority, you're not gonna be happy with the treatment. So I always give options of, this is what I recommend, but if your priority is volume loss over tox, I'm gonna tell you my reasoning behind it, but always go with what is best for you at that time.
What if I was just like, I only want the temples?
Fine.
Is that bad then? Because it's like, would that throw off my proportions?
Good question. I would say no, because you have volume loss in your temple, right? And like you have minimal adjustments. As long as the treatment that I'm going to perform isn't going to throw off balance of any other area, I'm okay doing things one at a time. So if you came in, like our last patient, and you wanted your lips over your chin, I would not be doing the lips. I would say we need to do the chin, and if she's like, no, I want lips, I'm gonna be like, then I'm not your injector. So I will say no in that instance. But for you, if you come in and you're like, okay, this is our game plan, we want to do temples, mid-cheek, chin, you're like, I do want to do these things, but temples priority, let's do that first, I would absolutely be okay with doing that.
No, that's really interesting.
Yeah.
Because I would feel like from a facial balancing standpoint, I have to do all three at once.
Not necessarily. And it also depends on the patient though. Like that's not going to throw you off. That's going to restore volume.